All right, let's get to a story now that we think's worth your time. The Oregonian this week did a deep dive into mental health care in Oregon and the way we've moved away from institutionalization over the years. The headline is Oregon tried to deinstitutionalize mental health care. Its failure echoes today. It goes into Oregon's history of treating patients with mental health concerns from when people were locked into asylums starting in the 1800s until the state moved away from that model toward community care. The idea behind community care is that people who need it get help in their own communities. But as we've seen, that hasn't really happened. We talked with the reporter who wrote this article, Jayathi Ramakrishnan. She heard from several people who've seen the holes in the community care firsthand.
One former patient from the state hospital, I think her story really stuck out for me because she'd been institutionalized for a really long time. And she knew that she said so, and I quote her saying this, that she knew when she got out, she was going to still need help. And what's challenging is, she just timed out of the system. They couldn't keep her there any longer. And not that she should have been there, but there should have been some other safety net when she got out. And it was hard to find her one. Her team tried. Various things didn't work out, and she kind of bounced around. She tried to stay with a friend. She tried to stay in a house that was focused on addiction recovery, but that didn't really have other supports. It was not focused on mental health specifically, and so it was really challenging for her because she didn't have those supports that she needed, and she didn't have much experience living outside of the state hospital and other institutions. And so, and unfortunately, her advocates have said they've now lost touch with her again.
The problem goes back decades to a decision made in the 60s that didn't really pan out.
From the late 1800s until the 1950s, asylum care was the main type of care. And then I think it was in 1963, there was a federal law passed to have states start looking into deinstitutionalization. And there was supposed to be, grant funding that went to states and local communities to do that. But as I said in the article, that didn't come through all the way. It didn't materialize. And so there's still one big institution in Oregon, and there were still some, for a few decades after that. But these efforts to kind of build these smaller community care facilities, and it's not that they didn't get built or that they didn't exist. It's just more that they didn't have the funding that they needed.
The article also talks about the ways people with mental health concerns end up in the criminal justice system. We've talked about this many times here on The Story, how the state hospital, Oregon's largest psychiatric hospital, is filled to capacity, overwhelmingly, with people waiting to stand trial. But when it comes to community care for mental health patients, many clinics and organizations are facing a lack of funding and a hard time finding enough staff to work these really difficult jobs. You can check out that article now in the Oregonian. And if you want to get more into mental health care in Oregon, well, we have an ongoing KGW series. It's all about the difficulty in getting involuntary treatment for the people who need it. You can find those stories by searching for the word uncommitted on kgw.com or on the KGW YouTube channel.